Considering microneedling for acne scars, is there a risk of scar tissue forming and orange peel skin? I really want to try microneedling for my scars, but I have read some reviews here saying it resulted in permanent orange peel skin and major loss of collagen. Also, a highly respected esthetician believes that it doesn't cause the body to create collagen, but instead causes scar tissue to be formed that will result in bad skin in the long run. Any thoughts on her logic? What may have caused the mentioned side effects and long-term side effects?
Thank you for your question. You've submitted your question without a photo. However, you are describing in your question a concern that you have about possibly undergoing microneedling to treat your acne scars. And you are concerned that in discussion with an esthetician that there might be more of a scarring potential rather than collagen induction, as is often suggested through microneedling, and that people who have had this treatment have developed an orange peel type of skin, and so you want to have some guidance on whether or not microneedling really works or doesn't work, and whether or not there's a potential for injury rather than benefit. Well, I can certainly share with you how I discuss this procedure with my patients in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Amongst the many things we do in our practice, everything from lasers, injectables, surgery, we do also offer microneedling, and I can certainly appreciate your concerns. So to begin with, I think it's very important, especially patients who will come for an evaluation, often come with this expectation that they're going to have a particular procedure because they'll make an appointment for that type of consultation. For example, someone like yourself may make an appointment saying that this is a microneedling consultation. And I often have to tell our patients to first back away from the treatment strategy and first define what the problems are. And the challenge when you describe something like acne scars is first appreciating the true specifics of the types of acne scars you have. When you look at someone with acne scars as a physician, you're looking to define what are the types of scars a person has. Do they have rolling scars? Do they have boxcar scars? Do they have ice pick scars? Do they have a combination? Do they have facial volume loss? And so we really want to look more globally and holistically. As far as the role of microneedling, I think what you are seeing is similar in ways that the way people are perceiving the downsides of a procedure when a procedure is done aggressively. And this is something that reminds me a lot of what the perception was with lasers since the mid-90s. Early on, when people were doing lasers, the lasers were very aggressive, and doctors were not always looking at the global long-term effect as well as the potential to cross a line between stimulation and remodeling to crossing that line into injury and scarring. And the same thing applies for any type of intervention, but microneedling does certainly have that potential. We see patients all the time who have had multiple microneedling sessions done in very short periods of time. And I think it's very important to understand that the philosophy of microneedling, which before the medical microneedling devices were developed, was originated by first a device called a derma roller. So, but the central concept of microneedling is something called collagen induction therapy. And what does that mean? Well, whether you're using a microneedling device, a chemical peel, a laser, what you are doing is inducing a controlled injury. That controlled injury is intended to stimulate a collagen repair response as well as a remodeling response to help improve the area of concern. Also understand that microneedling can be done at different depths. And I certainly understand that a lot of times people will be frustrated with the treatment. And this doesn't just apply to microneedling. This also applies to laser as well as radiofrequency heating devices. And it is almost a knee-jerk reflex for the practitioner to, if they get feedback that if a patient is not satisfied with the particular outcome, what is natural to do? Increase the energy, increase the depth, basically increase the aggressiveness. And again, that can result in a lot of challenges because now you've crossed a line. I find that when I evaluate my patients, I often first, after describing the issues based on a more global evaluation, for example, if someone has acne scarring and they have like rolling scars or atrophic loss of volume in the tissue, a lot of times just doing an injectable filler at the deeper level can actually improve the contour of the skin such that the acne scars don't look as deep. We can combine treatments so that you don't have to be as aggressive with one treatment. This has been something that I figured out years ago. So when people needed laser treatment or resurfacing or fractional resurfacing, I often combined fractional resurfacing by doing it more conservatively and then using platelet-rich plasma. Platelet-rich plasma derived from your own blood also induces collagen and stimulates remodeling. And therefore you can balance the level of aggressiveness. In some ways you can use the analogy of overtraining in the gym. You can lift up to a point and stimulate muscle growth, or you can result in overdoing it, overtraining, or injury. So the same thing applies to the skin. And in particular, acne scars are very, very challenging regardless of the modalities. But I think that it's important to understand your options more globally before committing to any specific one treatment. I really feel that when it comes to skin rejuvenation or skin treatments, we have so many more tools that it's kind of like combining the right modalities to get the maximum result with getting the minimal type of risk. So for example, like with acne scars, we can do a combination of injectable fillers deep. We can place injectable fillers at the dermal level. We can use laser. We can use PRP, and we can get a lot of the improvements that we want to improve. And of course, we can also use microneedling. So I think it's very important for you to choose a practitioner who has a lot of experience, who's going to be very clear about explaining all of these variables and understanding what kind of outcomes you can achieve. And also understand that a lot of the principles of skin treatment, like exercise-induced muscle growth, is about treating and then waiting to see how that treatment affects the skin. A lot of times people become subject to protocols which are not looking at the individual's response, but rather going on in a particular automated, standardized process. And when it comes to something like acne scars, one size does not fit all. Now there are certain protocols that have to do with the non-ablative lasers, which are a little bit more consistent, but I would say that it is important to really understand what kind of outcome, and really, is microneedling optimal for you? Are there other options that may be better for you, and maybe microneedling can be something that is used at a different frame of time. So meet with experienced doctors who do this type of work and learn about your options. And remember that when it comes to skin care and skin rejuvenation, especially when it comes to acne scars, the multiple modalities often work better than just a single approach alone. But it has to do with always about customization and not just about a single device. So I hope that was helpful. I wish you the best of luck. Thank you for your question.